Good morning and welcome to the Penn State College of Medicine COVID-19 Echo Series. We're delighted to have you join us for another session. My name is Jackie Sable. I'm a member of the Echo team and I'll be facilitating today's session. A few announcements before we begin. If you've not already done so, please put your name, email address, and affiliation in the chat box. We ask that you stay muted unless you're speaking. You can use *6 on your phone to mute and unmute, or you can use the microphone icon on the bottom left-hand side of your Zoom screen. We'll also be using chat for communication, so feel free to use either throughout the session. We realize that question and answer time is important to you, and we are trying to categorize and address as many questions as possible. But if there are any open questions, we will always follow up via email afterwards. If you have suggestions for future COVID-19 ECHO topics, please share via the chat tool, or you can email us at echo@psu.edu. Please remember that no personally identifiable information is allowed when discussing cases. We are recording these sessions and we share the recordings and all materials after the session. In the spirit of all teach, all learn, which ECHO is built upon, we'll be on a first name basis during our sessions. If you're new to Project Echo, our Echo sessions, you always begin with a brief lecture followed by case discussions. Cases could include a question or a challenge that need to be addressed, and they're a critical component of our Echo model. For today's session, Dr. Aditya Joshi will discuss recognizing and addressing burnout, and will share some case examples. During the lecture, please feel free to put your questions into the chat. We have a team of specialists from Penn State online. Depending upon their schedule, they will be here and they will help field questions. But remember, this is an all teach, all learn environment, so everyone is encouraged to share both questions and answers. We'll pause between the brief lecture and then we'll move on to the case after addressing any lecture questions. And with that, I'm going to turn things over to Aditya for our brief lecture.
Thank you, Jackie. Good morning, everyone. My name's Aditya Joshi. I'm with the Department of Psychiatry here at Penn State Health. And what I'm hoping to do today is to facilitate a conversation on the topic of burnout with an emphasis on the practical aspects of this issue rather than a more theoretical focus. So self-disclosure, I am not the eternal source of wisdom for all things related to burnout. My job is just to get the conversation and keep the conversation moving. And the hope is that together through our collaborative discussion, we will expand our knowledge base about burnout. We will expand our skill sets and hopefully leave this session with a change in our attitudes towards how we approach burnout. So as far as the specific learning objectives of this session are concerned, I've structured this talk in a way that we start off just building up some knowledge about the concept of burnout. So by the end of this one, we'll know a little bit about burnout and factors that prevent and mitigate burnout. As a next step, what I'm hoping we can do is to know how to be able to utilize knowledge we might gather, through self-reflection or through conversation with other colleagues or even our patients, and to synthesize that information into some kind of an actionable formulation. And then hopefully through our discussion, we will show how to apply these concepts in real life-like situations. And the ultimate goal obviously would be for all of us to be able to go out in the real world and do stuff to help people through various stages of burnout. So the question is, what exactly is burnout? So the concept of burnout is thought of as a syndrome where features lie in three different dimensions. There is emotional exhaustion, depersonalization, and personal accomplishment. So when people talk about emotional exhaustion, think of the person who feels completely drained at work, completely fatigued, burned out, frustrated, feels that he or she is at the end of their rope. That would be the flavor that would come under the emotional exhaustion category. As far as depersonalization goes, that essentially refers to the kind of emotional detachment people might have, especially when symptoms of burnout are particularly severe. So people might find themselves emotionally hardened, not caring about what happens to their colleagues and people affected by their work. And people, instead of coming across as human beings, just seem to be impersonal objects. And the third dimension is personal accomplishment. So this would be, someone who feels, or the lack thereof of, a sense of energy and exhilaration that can come about when you're feeling satisfied with your work, the sense that you may have accomplished something truly well, and that you're positively influencing people by what you're doing. People who tend to be on the extreme of the burnout spectrum tend not to feel these kind of symptoms. Um, so when you talk about burnout and studying burnout and getting a sense of, well, how badly burnout is someone, the most commonly used scale is a scale called the Maslach burnout inventory. This one is supposed to be essentially the gold standard of burnout research. And the inventory basically has a bunch of questions, 22 in total. And all the questions have responses which lie on a 7-point scale from 0 to 6. So they will ask you a question and say, well, do you feel this way? Not at all, or pretty much every day. So the answers lie somewhere on that scale. And then there are 9 questions which focus on emotional exhaustion, 5 on depersonalization, and 8 on personal accomplishment. And at the end of that, on every dimension, you get a score, which gives you a sense of where you might lie on the continuum. Now, one important thing to remember is that the way the Maslach burnout inventory was conceived was, they looked at, they essentially made that scale to as a research tool to study the phenomenon of burnout. So what they're looking at is, we're looking at an emotional experience. Where do you lie on that continuum? So in the past, they used to have cutoff scores where they would say, well, if you're above score X, Y, or Z, your presentation is mild, moderate, severe, but they've actually done away with that. So if you ever refer to literature pertaining to burnout, at least in the the older papers will talk about, well, this person's burnout is severe. But Maslach and colleagues have done away with that because they felt that those cutoffs were really very arbitrary and not necessarily based in science. They basically said, the top third percentile is severe, the middle third is moderate, and so on and so forth. So the newer literature may not refer to it as much. When you think of burnout, it's not a either or construct. So it's not, for instance, like pregnancy, where you're either pregnant or you're not. So with burnout, things lie on a continuum. You could be experiencing very mild features of burnout, which may not rise to the level of clinical significance, but then you could have features that are clearly impairing your ability to function. So just remember that, and that's an important thing to remember. So I promised you I would try to focus on the practical aspects of this, and my assumption is most of us do not walk around with a copy of the Maslach burnout inventory in our pockets. I can tell you it costs $50 to have one, so I'm pretty sure none of us have that. But in real life or in your clinical practice, how would you necessarily spot signs and symptoms of burnout? So obviously, if you want to read more about it, PubMed and Google will probably give you access to a copy of the burnout inventory. But I came up with a very, very crude method, probably extremely unscientific, but this is my talk. I can do whatever I like, so I will say it anyway, on how you might be able to spot symptoms of burnout. So I'm going to take you through an exercise, okay? I'm going to say 3 sentences, which will have a blank in them, and I would like you to fill in the blank. The only thing I would like you to do is I would like you to think of the most profound 4-lettered word you can think of and use that to fill in the blank, and that word cannot be golf. Okay, please don't say it out loud, and please don't type it in the chat box. So here's the first sentence. Probably pertaining to the emotional exhaustion diagnosis. So, when you think of your job, you think, in quotes, I feel like blank. Okay, think of a 4-lettered word and fill it in. Here's one for depersonalization. When I think of people associated with my job, I realize that I don't give a blank. Okay, that would be depersonalization, where you feel emotionally detached. And the third one about personal accomplishments is when I think of what I've achieved at my job, I realize that I ain't done blank. Okay, if you find yourself answering very profoundly to any of these questions, either you or the person you're talking to is probably somewhere far along that spectrum. Okay, so just again to reinforce the point I made earlier on, when you talk about burnout, it's not an either or concept. Symptoms lie somewhere on a continuum, and there's no way to say that that someone is burnt out when the symptoms have reached level X, Y, or Z. It's a very personal thing. Some people might reach the level of what we say is clinical significance earlier on. So, someone who's rare on this scale on your screen right now might be feeling symptoms of burnout, as might be someone who is medium well. Okay, so just remember that concept. It's not an either or thing. So when we talk about burnout, who are the people who are less likely to be burnout? What kind of factors are likely to prevent burnout? And there are a whole bunch of them, but the one I really want to focus on right now is something called is a concept called emotional intelligence. So uh, this was a concept that was brought forward by a person called Daniel Goldman through his writings, and he and his colleague think of emotional intelligence as being a characteristic or a group of skills which lie on four different domains with various subcompetencies. So a lot of this work comes from the business world when studies on leadership, and when they look at who's going to be the most effective leader, what they realize is that beyond a point, IQ doesn't really matter that much. If you get to a person of being a CEO of a company, you're probably reasonably intelligent, but the more successful CEOs tend to be the ones with a high level of emotional intelligence. Similarly, if you look at studies from burnout, people who are less prone to getting burnt out are people who have a higher level of, are able to demonstrate a high level of emotional intelligence. And the four domains of emotional intelligence are self-awareness, self-management, social awareness, and relationship management. So self-awareness means being aware of your own emotions. If you find yourself feeling irritable or angry or sad in a situation or during a conversation, being actually aware of what you're experiencing is a very important and a very handy characteristic or trait to have. Self-management would be the part where, even though you might be feeling charged up or worked up during a conversation with a colleague, the part where you don't get up and punch someone in the face or don't go and kick your neighbor's dog. Social awareness, the construct that might be most useful for you might be empathy, being able to see the other person's viewpoint in an argument, especially if there is significant disagreement. And then there is relationship management, where you may want to have better conflict management skills, for instance, or skills where you might be able to influence people to kind of look favorably at your viewpoint. So um, for those of you who are more interested in the concept of emotional intelligence, there are three references over there. There's one at the end of this graphic, which is actually an article by Daniel Goldman in Harvard Business Review. And it says emotional intelligence has 12 elements. And this is a very interesting article where they also talk about how emotional intelligence is a very important thing to have, but it is developed, the various competencies are developed to various extents in different people. So even though you might be very good at one aspect of it, there is always scope for improvement. And there is another article from Harvard Business Review, which I have referenced, which talks about why some people get burnt out and others don't. And there's another one from actually the nursing world, where they talk about how emotional intelligence is a protective factor against burnout. So there's some food for thought over there. So the other thing I will point out is that a lot of references I've used in the essence of keeping this discussion practical, they're actually not very dense articles from scientific literature. I've put in a lot of articles from the business world, which kind of makes it slightly more easy to digest, to be honest with you. Okay, so let's move on to our first case. Okay, I will read it out aloud to you. Dr. X was having a really bad day. His patient John Doe was not helping matters by refusing to listen to logic. Prior to this meeting, the inpatient treatment team had spent considerable time in planning his discharge, taking great pains to anticipate every potential need. Yet, John just didn't seem to get it and grew increasingly irritable as the conversation progressed. He then curtly asked Dr. X to get the hell out of my room. Dr. X walked out feeling bitter and demoralized. It had been a tough 2 weeks on the inpatient service, and he had frankly had enough. He wondered if he had actually done anything worthwhile for his patients and whether he had conducted himself poorly in front of his resident and medical student. As the charge nurse approached him in the hallway and asked how their patient John was doing, Dr. X snapped, "Frankly, my dear, I don't give a damn." Okay, so I will throw two questions out for you, and maybe we'll take a pause for a moment. What elements of burnout, if any, can you spot? Okay, um, and how might you possibly apply the concept of emotional intelligence over here? Take a couple of seconds, and then I will come back to you. Okay, time's up. So see, I'll tell you what I spotted, okay? And then you tell me if it makes sense or if I'm just talking a whole lot of rubbish. But, when you look at the aspects of burnout in this case, you know, um, the part where he said, "I think I've just had enough," that would probably fall more under the emotional exhaustion category. Um, Personal accomplishment, the fact where he wondered if he's done anything worthwhile, if he's really done anything to positively influence the students and learners on his team, and the depersonalization part where he's at a point where he really doesn't care what happens to others or how others feel. So I saw a comment pop up on my screen, and I cannot bring up the dialogue box, but I would agree that they're showing probably a little bit of all three elements. Now, at this point, how significant is the issue right now? We don't know, because we haven't really studied it to the extent of, is this happening every day, um, and to what level the features are affecting Dr. X. But at least we're starting to spot the kind of things we need to be able to spot. Um, how might the concept of emotional intelligence be applicable over here? So, the first step would be for Dr. X to kind of recognize that they're pissed off right now. They're pissed off with the world, with the patient. They're feeling frustrated, uh, and then obviously the idea would be, you're not feeling well. Time out. Take a break. Walk away. Think on why you're feeling the way you're feeling, and then maybe try and come up with some kind of an answer. And empathy might play a part over here too. So Dr. X is getting irritable. Well, so is the patient. Does the patient have a reason to feel irritable? So this is where I come in and tell you that actually this case is based on a real life situation. I was Dr. X at one point, and I've obviously taken artistic license over here. Not all of this happened, but the real life scenario was I was on the inpatient unit. It was a tough time, and I really was finding myself getting increasingly irritable in a discussion with the patient. And at some point, I realized I was getting flustered. So, it was the inpatient psychiatric unit. The patient really couldn't go anywhere. So I said to the patient, "Why don't we take a quick break and regroup in a few minutes?" So, we sent the patient off for lunch, and I had a chance to sit in my office and think, well, I was getting upset with this patient. I did not get into medicine to get upset with this patient. What was going on? So I went back to the patient. We sat down and I said to him, "Look, I realized we were both getting worked up during the conversation. I was trying my best to help you. Tell me, what did I miss?" So the patient said something very interesting. He said, "Look, I'm worried about what will happen to me when I get discharged." This was a patient who had a history of a traumatic brain injury. He said, it's difficult for me to process information at times. And you were just flooding me with too many facts and too much information. And frankly, I was feeling overwhelmed and I didn't know what else to do. So suddenly a light bulb went off. We were in the patient rooms, and if you're used to going to inpatient wards, every ward has a whiteboard where you can write stuff. So we just wiped it clean and turned our discharge plan into a very nice infographic where we said, well, you want to get from point X to Y, and there are many ways of getting there, and these are the options you have. And by the end of the conversation, the patient and I were not quite best friends, but on good terms. And that really helped move things along. But for me as a practitioner, that gave me a tremendous sense of accomplishment that I had truly achieved something good for my patient, which means that I did not get burnt out. And here I am talking to you about it. Okay. So at this point, you may not realize, we've actually hit our learning objective too, where you now know how to manipulate information from real life into and know how to use it. Okay. So if you do spot a colleague or a patient who's getting burnt out, what kind of things you can do? Now, I'm going to take you through things you can do immediately, things you can do for yourself over a period of time, and very importantly, and this may not seem very pertinent to what do I do right now, but very importantly, things you can actually do in the context of making changes to the system you're in, because burnout very often is a result of a conflict between your own personal motivation and the stress that a system you work in imposes on you. Okay, so immediate things. Oh, sorry. Okay. Like I said, every day at work and in life, we're faced with a tussle. The tussle is between things that motivate you, and things that tend to stress you out. And when stress has an upper hand, that's when burnout is more likely to creep out of the shadows and start bothering you or impacting you negatively. So there are very simple strategies which you could use in everyday life to keep a lid on the stress. And again, what I'm saying is, out of the literature, this isn't what my grandma told me. This is their scientific basis. I just don't have the time to go into every bit of evidence for this. Just take my word that these things work. Mindfulness. So I did a talk a couple of weeks ago, and someone said to me, "How do you explain mindfulness in a way that it does not sound like a, in quotes, woo-woo concept?" Okay. So here's my 30-second take on what mindfulness. So if you ever find yourself in a stressful situation, and I'm pretty sure all of us have gone through that, there are a whole host of thoughts that swirl through our mind. You think about what's happened in the past, what X, Y, and Z said, the kind of decisions that were taken. You think about every conceivable situation and scenario in the future. So essentially, a lot of thoughts race through mind, and mindfulness is a kind of meditation which helps you focus your attention on the here and now. Okay, so you don't think about what Lisa is going to say 3 months from now, or what John did, or and so on and so forth. You just say, well, I'm going to narrow my focus down to something very mundane, and I will maintain my focus. It's not easy to do, but the more you practice, the better you get at it. For instance, some mindful techniques will just have you shut every thought out of your mind and just focus on different parts of your body. It's a technique called body scan. So if you look at the link I've provided over there, that takes you to a site called positivepsychology.com, which has a huge treasure trove of exercises. And there are some very nice videos which you can use there. There are lots of things to choose from. Some things might work better for you than others. Have a shot at it through, and it has some videos from people who are very, very highly regarded in the mindfulness world. Again, for those of you who are not quite sure, mindfulness is a type of meditation. Kind of the analogy would be, um, you know, meditation is a more broad umbrella term, like say sport. Mindfulness would be a type of sport, like soccer or football. Okay. The other thing which you can do, and these are things you can do in a few minutes, for a few minutes every day, is keeping what is called a gratitude journal. And you can do it in two ways. One is to think of one thing you're really grateful for and write a kind of a brief narrative on that. You can also download worksheets from a website called therapistaid.com, where they will say to you, look, just take a couple minutes and write about 3 things you're grateful for. And it's a very structured worksheet, so you don't have to do too much thinking, except for, identifying your thoughts. And if you do it for a few days, there's evidence that that simple exercise and intervention helps reduce stress. Guided imagery is where a therapist or someone who facilitates that process kind of takes, encourages you to think of a positive experience you had, and will take you through all the sensory aspects of that experience. So if you're imagining being on a beach, they will talk about, well, from a tactile point of view, think of what the sand felt like, think of the water kind of, trickling through your toes, and so on and so forth. So I've put a link to a video. This one is, I think, out of Johns Hopkins. And if you Google actually guided imagery videos, you'll get a whole bunch of it. I picked this one because personally I like this one the most. This was the least woo-woo sounding of all the videos that was out there, okay? Diaphragmatic breathing is an exceptionally simple technique, essentially slowing your breathing down with a focus on, expanding the diaphragm rather than the thoracic cage. Uh, the Cleveland Clinic has a very nice document. The reason I picked this one up as opposed to others is because it actually has illustrations on how you might go about doing it. And again, if you look at the literature for diaphragmatic breathing, just doing this very simple exercise has been shown to decrease cortisol levels, to reduce blood pressure, to reduce anxiety scores on various scales. Uh, Progressive muscle relaxation is a technique where you look at one muscle group at a time. You tighten it, and then along with deep breathing, you relax the muscles one at a time. Again, very simple interventions. You could probably start doing them as soon as we're done with this discussion, and then get on with it. And again, the video I've referenced over here is out of one of Johns Hopkins clinics. I think their rheumatology clinic has put this one up. Again, there might be other resources out there. These aren't the best resources. These are the ones that kind of made most sense to me. So they reflect my personal bias in some way. So, okay. So for those of you who might be more interested in mindfulness-based stress reduction, and this is a shameless plug, one of my colleagues, Dr. Michael Hayes, actually conducts these classes at UFC, which is University Fitness Center. And I guarantee you that these classes are not going to be held in an octagon. This is not that UFC, but the registration is required for these ones. So I thought I would pass that on to you. This is a resource available within our institution. Okay, other individual strategies. So, there are things you can do immediately to kind of help reduce stress, but then there are things you can reflect upon and work upon as you go on. So reflect on fulfillment at work. If you have a job that pays you $1 million, but is the most terrible job you've ever had, at some point those $1 million will start to not seem as charming as they did at the beginning, and it will result in burnout. So think, am I enjoying what I'm doing? If not, what can I do to change that? Think of work-life balance. Again, this could be one of those instances where the fulfillment you get at work might be overshadowed by requirements in everyday life. So this is, again, a very, very significant stressor. So when you look at burnout literature, they've looked at differences between are female practitioners more likely to get burnt out as compared to men. So for men, a bigger stressor is the workload. What the literature tells us is that for female practitioners, the conflict between work-life balance might be something that might predispose them more. Develop stress management and positive coping strategies. So, your coping strategy probably should not be drinking 2 bottles of vodka at the end of the day. But then maybe, de-stressing in a way that is more productive might be useful. And again, as I said before, some of the emotional intelligence competencies tend to be more inherent, but the ones which aren't can actually be developed. The other thing to look at would be, developing what is called resilience or grit. And again, grit or resilience is a quality that is actually being shown to predict who will accomplish challenges and handle goals better. There's research out of West Point, for instance, where they say that the cadets who tend to do best are not the ones with the highest IQ or are physically most gifted. It is the most gritty cadets. And again, grit is thought of as a construct that includes a passion for what you do, the ability to persevere in the face of adversity, being adaptable, learning and improving from your mistakes, and having a clearly aligned hierarchy of goals in terms of what you want to achieve. And again, when you talk about grit and how it can prevent stress and help you accomplish goals, it's not just individual grit, it's also the grit or organizational grit in terms of how gritty are organizations, how what kind of goals do they have? Do they have processes in place that are aligned to help people achieve that goals? Are they providing their people with the tools to achieve those goals, and so on and so forth? So and then there are organizational strategies. So this might not seem very pertinent right now, but remember, burnout does not occur in a vacuum. it usually is a result of or a product of the system we're all embedded in. So as we think about, how we mitigate burnout in ourselves and colleagues, one way of doing that would be to be an agent of change and be the person who fills in that engagement survey that comes to you, or who volunteers to be on that committee. So things which are known to contribute to burnout, which you could help, is creating a safer environment, making sure you're on that committee that ensures there are adequate resources, um, demand effective leadership from people who are leading your organization. Ask for effective communication and resources for what you're being asked to do. um, Help negotiate a fair workload and productivity targets. And even as leaders, it is incumbent on us to create an environment, because burnout will not just affect personal performance; it affects organizational performance too. Um, Having developing the processes which enable homework integration and employee engagement. And even as we're thinking of and talking out loud about these, think in your mind, is my organization doing this? Is the organizational leadership communicating with me in a regular way and an open way? Are they engaging employees in various stages of development of products or policies? The kind of things you may want to help weed out is, administrative burden and policies are a huge source of stress and burnout for practitioners everywhere in the country. There's a very interesting article, I think, in the New England Journal of Medicine, where a health system in I think, Hawaii, looked at factors related to the EMR, which were resulting in burnout, and they came up with a program called "Get Rid of Stupid Stuff." And when I heard about this in a conference once, they said that the only reason they used stuff instead of another S word was because then they would never have gotten it published. Um, so if you can look up that article, that would be a good one too. And of course, look at dysfunctional work cultures and processes and weed them out. So I do want to draw your attention right to the bottom of the screen, because there are some very nice resources to help you. There's a very good review article by West and Shannafelt, and these guys are prolific producers of literature as far as burnout is concerned. Then the second one is actually a very interesting article I stumbled upon. This is from a bunch of radiologists who talk about what are called micro practices for burnout prevention. So these are things you can implement, while you're in clinic, and it takes a couple of minutes. And these are strategies, stress reduction strategies you could use. There's a Harvard Business Review article on, one way to prevent clinician burnout. And there are two very other interesting articles from Harvard Business Review. One is Building Resilience. This one is from a very famous person called Martin Seligman. He is the person who kind of came up with the concept of learned helplessness, where you run experiments where you basically shock rats, and one set of rats has the ability to run away, the other one does not, and at some point the rat that cannot run away says, well, to hell with this, nothing will work anyway, shock away. And he's done a lot of work, especially with the military, on building up resilience. Speaking of which, our own Office of Professional Mental Health is actually running sessions on building professional resilience. Dr. Kelly Holder and her team, I know, conducted a session a couple of days ago, and there are some more to come. So please be on the lookout for that. That might give you more skills in terms of this. And then there's a very interesting article called Organizational Grit. Again, this is a Harvard Business Review article by a person called Tommy Lee, who is a practitioner at Brigham and Women's, I think. He's also the CMO for Press Ganey, and he co-wrote this with a person called Angela Duckworth, who is a professor of psychology at Penn, who's written a very interesting book called Grit. So again, a lot of what I've spoken about can be referenced, can be linked to these references. Okay, so that brings us to our third learning objective, right? Can we put our money where our mouth is? So let's talk about Jane Doe, okay? This isn't a real life scenario. I just made this up based on what I've been hearing from others and so on and so forth. So let me read it out loud. Jane, a colleague of 25 years, approaches you in tears. She's distraught after being admonished by Kathy, the hospital's chief nursing officer, for wearing an N95 mask, contrary to hospital policy, which limits the use of these masks only in the ER and ICU. Jane was told by the CNO that the hospital was critically short of N95s and face shields, and managers were desperately trying to conserve these for the use of providers directly involved in the care of the hospital's COVID-19 patients, and that Jane's workplace, the cancer center's infusion room, was not a higher priority area vis-a-vis the ER/ICU. Jane tells you that she realized her blood was boiling when she was being told this, but was cognizant of her rage and therefore decided against telling Kathy to stick it. I just did not want to do something in a fit of rage I would later regret. I kind of respected Kathy, but she sounds like a management stooge. She's one of them now, unquote. Jane does confide to you that the last month or so has been particularly tough for her. She has felt emotionally drained and dreads coming to work daily for fear of her safety. She tells you she would never consider calling off of work because, in quotes, that would go against every oath I took to serve my patients, unquote. She has felt increasingly frustrated at the thoughts that a hospital has not been paying attention to workers' concerns, and a friend who recently attended her department's grand rounds told her that the speaker there had recommended the N95 as a minimum requirement for all healthcare providers. Jane tells you she simply cannot understand why she wasn't allowed to put a mask on, in quotes again. After all, I'm dealing with immunocompromised patients all day, unquote. You're left surprised at this exchange. You've known Jane to be one of the most calm and stoic colleagues you've ever had, who has effortlessly survived many a change in all her years in the organization. You walk away helpless, not knowing how to help your beloved colleague. That was a theatrical flourish at the end, but I'm sure you wouldn't walk away feeling helpless. But let's go on to the talking points over here, okay? Is Jane suffering from burnout? And perhaps I've not worded this talking point in the most optimal way. Do you, at this point, spot any signs that might think, well, does she have any features on any of the dimensions of burnout? So let me go back to one of my previous slides so that it'll be easier for you. I would like to decrease your cognitive load at this time and not have you remember what those points were. Okay. So from the conversation, could you pick up any signs of emotional exhaustion or depersonalization or personal accomplishment? Think out loud. You don't have to say it out loud or type it, but just think. I can tell you, for me, I probably picked up some elements of emotional exhaustion, where she's feeling emotionally drained and frustrated with the entire situation. I don't see anything to suggest that she really doesn't give two hoots about her patients, or she seems pretty proud of what she's generally done. So I don't see her taking a hit. But that's just me, okay? You can differ with me. Like I said, I'm not the source of eternal wisdom on this one. But this is how I would conceptualize, Jane's predicament. Can I spot something and can I point her in the right direction? Okay, let's go to the second talking point, which was what immediate interventions could you suggest to Jane? So she's clearly under a lot of stress. What could she do? And for this one, I would say maybe kind of bring to a consciousness the fact that she is under a lot of stress, and perhaps suggest some immediate stress mitigation strategies. And in terms of what elements of AI would you help Jane reinforce and develop? Let's go back and look at what the elements of emotional intelligence are. Self-awareness, self-management, social awareness, and relationship management. So is Jane self-aware? I would think probably yes. I mean, she was able to recognize she was getting very angry and walk away without punching Kathy in the face. So in that way, she also, exhibited tremendous self-control. A lot of people wouldn't. The one thing that when I was reflecting on this case after writing it, that I thought of was could Jane possibly be more empathic? She's clearly upset that she does not have a piece of personal protective equipment that is critical to her job. But when I thought to myself, well, let me put myself in the manager's shoes, okay? Could the manager possibly have a point? And I did not get a sense that the manager was suggesting, thou shalt never have an N95 available to you. I got a sense that the situation was that there were only a certain number of N95 masks available. And then they said, let us find out who is most in need of these masks, probably people caring for COVID-19 patients in the ICU or who were dealing with them in the emergency room. Let's make sure they have enough before making sure others have them too. So clearly not an ideal situation. But if I had to justify my own actions as that manager, that's probably what I would have done. And I wonder if it would have helped Jane having that bit of insight. And again, you will see that not all elements of emotional intelligence and not all competencies need to be brought down to bear on any particular situation, but you may well think of other things that you could possibly use. Okay, so and you may not have realized it, we've actually hit our last learning objective. Which means it's time to summarize. So when you look at burnout in your colleagues and in your workplace, I think approaching it systematically is probably going to be the best way to look at the problem. So the first and foremost thing is recognize burnout or elements of it. I would then say take immediate steps to mitigate distress. That would be your stress management strategy. Shore up your own defenses in terms of building up emotional intelligence and resilience. And these things can be learned. Be an agent of systemic change because, burnout is generally, as I said, a product of the system you work in. Apply all of these, reflect, and pick up more problems and repeat the entire process. So this would be my cue to now shut up and yield the stage and mic to everyone else. Thank you very much.
Thank you for a wonderful discussion, our presentation and thought points. So let's open it up. Does anyone have questions or comments specific to what was just presented or anything else to contribute to this discussion?
I just wanted to say thank you so much. I laughed all morning. You're a wonderful presenter, and everything you said made me laugh, which is really what we needed today instead of presentation. I've been waiting for this specific presentation, I think, for 2 weeks since you said that you were going to put this out. And I'm just so excited that I came, and I giggled the whole time. I can't wait till I get the slides so I can go through it with my staff. So I appreciate you so much for making me giggle today, especially this early in the morning. Thank you so much.
Thank you. Thank you for the comment. We're seeing a lot of agreement in the chat. And so I think you mentioned sharing this with your staff. Has anyone come up with ideas or strategies, not just for yourself, but for your staff and your colleagues that we could bring to the table now?
Well, I can comment again. I wanted to share this with my management staff. I'm echoing. So what we have done is we've created stand-up, stand-down meetings. So prior to or after each shift, each one of us managers is available via Zoom. Whether it's you need technical challenges to be resolved for yourself or whatever is going on for the day. So there's 26 different meetings throughout the week And what I've found is nobody's coming for a technical issue, because I thought that that's what they would need from us, but we're also there emotionally. What's happening is they are coming with the burnout, and we're able to work through each session or each case with them, or what's going on. And what they're identifying is it's not necessarily burnout from what's going on with their clients. It's literally the home and the client together. So we're able to do those de-stressing techniques. And it's been so exciting to be able to see how they're coming just to debrief and getting what they need emotionally, so that their batteries are charged again and going right back to what we're doing. What we decided as a team is that we're going to keep doing this forever and ever, amen. Because what we do is we change some practices, and what we know is this works. It's working now, so we're not going to change it, and we're going to keep doing it in the future.
Thank you for sharing that, Heather. Yes, I see. I will unmute you. Go ahead.
Hi, firstly, I would like to thank the presenter, because at mid of this pandemic of COVID, this presentation is very important. And I think everyone is facing these type of problems day by day. I would like to suggest that in our institute, we have done something else, that all those who are working under this pandemic, we are giving some type of promotional benefits as well as appreciation letters from the higher authorities for their better work. So at least they have some motivational spirit to work hard.
Thank you for sharing that. That's a great strategy. Is anyone else implementing things, either personal or across your institution or your group? There's a comment. Go ahead.
Lisa.
Go ahead.
So our facility does mindfulness and like positive messages like twice, 3 times per year shift over our work iPhones. And it's kind of linked to a breathing exercise, so that it's just, 10, 20 seconds of just taking that time, and as a reminder.
Yeah, and again, just to stress on, what you can really expect out of something like a mindfulness exercise. It's a very important tool for rejuvenating ourselves. So the best way I can describe what mindfulness does for me is, think of the best power nap you've ever taken during a day. That's what it does. It kind of renews that sense of energy for you to be able to go back. It will not necessarily change the system you're in. So if your boss is a jerk, he or she will probably remain that way, but it'll help you deal with that situation just that little bit better.
So there is a comment in the chat that it would help the PPE issue if administrators would apologize for not having them available. Any comments regarding that?
I mean, I think if we look at it from a systemic point of view, right, how can we change the system around us to make things better? I think the learning point over here is probably to never let something like this happen again, right? This was stuff that we heard of when we were reading about a natural disaster in some other part of the world, which we couldn't locate on a map, but now suddenly it's happening at home. And I don't think we could necessarily change that, but this would be the part where we say, well, what kind of systemic changes can we make so that, at least the next time this happens, our focus is, how do we manage the illness rather than, will I have a mask to put on when I go to work today? But certainly this is a call for reflection and and saying, you know, how never again, but how do we get to that point of this will never happen again?
Great point. I have two more things in the chat. Deidre is sharing that they do 30-minute mindfulness sessions 3 times a day, available to all staff and faculty. So kudos to you for doing that. So there's also another comment, an interesting point heard through this presentation and self-experienced. You're not always aware that you're stressed out. Thinking you're handling things calmly and pretty well, then after a buildup, you just emotionally lose it. You actually have been overwhelmed and tried to push it down. And you know, they're mentioning in our chat now we have some good exercises to help relieve that stress. So thank you.
Hi, Jackie. If I could chime in from State College. This is Pete Rainey at State College.
Please do so.
I work at a residency in State College for a family medicine department. We try lots of things in residency already, so we just kind of keep using that structure. And I want to be careful not to list off as ideas to start right now, but we do quarterly wellness meetings, so we just kind of squeeze those closer and are doing like weekly wellness check-ins. One thing we started trying to do as a residency is to use social contagion. So like if I do something that's appreciative by somebody else, to pass that on to somebody else. So we recommend that the resident or the faculty member or whoever the staff member is to say to somebody, thank you for doing that, and then also share with somebody else what they saw that person do. So not only do you see gratitude in your own life and express gratitude to somebody else, and then you share it with somebody else, and that kind of passes the ideas around that people are doing good things and do deserve some praise. And it kind of passes it around and kind of amplifies it.
Thank you for sharing that. So we're also getting some really good resources and opportunities listed in the chat. I'm not going to go through and read all of them. I'm sure that they'll be summarized and shared afterwards. But there is a question that hopefully we could address. How do you help a colleague that is showing signs of burnout, but that person's not particularly self-aware? Are there strategies to reach out to them and help them?
I can chime in. You know, one of the ways you could do is, one of the strategies actually that's mentioned in one of the papers I've referenced is sometimes just taking a few minutes in a day to identify your emotions, even when you're not feeling particularly stressed, so that it becomes easy for you to do so, you know, when the stress does hit, kind of exemplifying the concept of the more you sweat in peace, the less you bleed in war. And actually there's evidence from you know, MRI studies which shows that when you do that, especially in a stressful situation, you move the focus away from a part of your brain called the amygdala, which is the part that processes fear and negative emotions, to a higher level functioning, the ventrolateral prefrontal cortex. So there's actually scientific basis for that too. So I think it's practice, practice, practice. My own way of doing it is, I mean, I'm a psychiatrist by profession, so that thing was kind of, you know, I've been brainwashed to think that way anyway. And I'm often left thinking, particularly if I'm not having a great feeling, I just pause and say, well, what exactly is going on here? And then, you know, why am I feeling this way? Sometimes, you know, the feeling's there for good reason, but often it helps me pick up on things I can change. And it actually, I'm sure it helps my patients when I do that, but it's particularly helpful for me too, because then I don't go back home at the end of the day thinking that, you know, this has been a complete waste of my time.
So before we move on to another question, I wanted to ask if anybody else has input for Gloria's question around reaching out or strategies to help a colleague or to reach out to a colleague. All right, well, if anyone does have anything, you feel free to unmute or go ahead and put it in the chat. So there's one question that's going to take us back around to the case and the PPE. So Deidre, poses this. One aspect of stress is the shortage of PPE, which management does have limited control over right now. How should people in the position of the manager, Kathy, in your case, cope with her own possible feelings of helplessness? Are there managers that are dealing with this that would want to share anything, strategies? Well, if nothing else, this gives us all something to think about, because I believe in the beginning of the session, Aditya mentioned that this is the start of a conversation to build collective knowledge. So it is something for us to keep considering. Andy,
Jackie, if I may, I'm thinking, and I was thinking when I was reading that question, what would I do if I were Kathy? Because Kathy's probably getting torn with the frontline staff mad at her because she doesn't have enough masks to hand around, and the management saying, I think one way of mitigating the situation might be just to be, very, very open and upfront with people and be very transparent and say, look, we have, 20 ventilators available. We have, 25 people who might need it. It's a terrible situation to be in, but this is what we're going to be doing to decide who gets one or who doesn't. And it's a terrible decision to make, but at least I suspect if people know why that decision is being made and it's not being done in an arbitrary manner, then that might soften the blow somewhat.
Thank you. Andy, do you mind if I put you on the spot instead of reading your chat comment? If you could talk about that.
Sure. I'm Dr. Andy Perwolis. I'm one of the doctors with palliative care here at Penn State. In terms of approaching a colleague who you're concerned they don't really have a lot of insight into their own emotional state, sometimes just an expression of care towards them and coming up to them and saying, you seem like you're more stressed today. What's going on? Tell me what's happening. And just really trying to understand what they're going through. And sometimes that will give them the space that somebody cares about them, that somebody's acknowledging the suffering that they're going through, gives them the space to feel more comfortable sharing about what's upsetting them. Doesn't always work, but I think that's a good place to start in terms of, and also just kind of putting it out there that you see them and that you notice what's going on with them, and then giving them the space to talk about what's bothering them or not.
Thank you for sharing that and for letting me put you on the spot there. Are there any other questions or comments? It's getting close to our ending time, and I am aware of all of your busy schedules. Any last comments, questions?
Yeah, this is Pete Rainey, State College again. In response to the question about what it's like to be a manager who can't provide what the employees would like, I deal a lot with this with residents who want things from an institution and where the residency lacks power to provide them what they want or what they feel is needed. And I like the football analogy here to maybe be useful. We're looking for a 5-yard gain even though we need a touchdown. And so what is the next manageable thing I can do to move towards the goal? And in the end, we may not succeed with that next 5 yards, but when I'm talking to people who are frustrated about what is or isn't being done, what I can say is this is what we're trying to do right now. And then I own transparently it may not be sufficient, but this is our current best attempt to move the ball forward.
Thank you, Peter. Great analogy with your football scenario. All right, closing comments, questions? Feel free to put any last comments or questions in the chat. Again, we'll continue to answer things via email or in our summaries. And I just want to wrap up reminding you that you can collect CME credits for participating today. A survey will be sent out following the session. Please complete one survey for every session that you attend, and you can use the same link for each submission. Again, we will be sharing all material. I think Ellie has posted the links in our chat. And finally, we hope you will join us for the next COVID Echo session scheduled for tomorrow at 8 a.m. Dr. Andreas Achilleos will be discussing COVID-19 outpatient testing and procedures. If you have a patient case or question on this topic, please let us know, because it's always beneficial to discuss your strategies and challenges in these sessions. And please continue to watch your email for the additional sessions that we are scheduling. Thank you. Stay safe and have a great day.